They're the ones who live with the child. They're the ones who raise the child. They're the ones who love the child. They're the ones who should make the medical decisions.
That is Governor Mike DeWine earlier today defending his veto of House Bill 68, saying gender-affirming care should not be decided by the state. He is also implementing new measures for gender-affirming care after vetoing House Bill 68 just 1 week ago today.
Well, during a news conference earlier today, the governor announced an executive order and other new requirements for both minors and adults seeking this care. We have live team coverage tonight on this announcement. We're going to start with 10 TV's Carly Dion, who joins us live now from the State House. Carly?
Yolanda, Andrew, just before the press conference this morning, the governor signed an executive order banning gender transition surgeries for minors. He's also implementing new requirements for anyone seeking this type of care.
Whatever the legislature does, we're going through with this. This is something that's important.
Just 1 week after Governor DeWine's veto of House Bill 68, he's implementing new rules and guidelines for gender-affirming care, starting with an executive order banning gender transition surgeries for minors, effective immediately.
This will ensure that surgeries of this type on minors can never happen in Ohio.
DeWine says there is evidence that there are very few surgeries of this type taking place among minors, if at all. His focus is to ensure the protection of children.
In the entire time when I talked to families, not once did they mention, gee, we want to have surgery on our minor child. That is just never mentioned.
Beyond that, multidisciplinary teams of doctors will now be required to support individuals seeking gender-affirming care. He says it will be an in-depth care plan with sufficient and informed consent for patients and their parents if they're minors, with a focus on mental health.
It's clear that the most important part is the mental health counseling. It needs to be lengthy and it needs to be comprehensive.
Healthcare providers across the state will also now be required to report what's referred to as de-identified data on cases of gender dysphoria and treatments that follow. This means it will not reveal identifying information about the patient, and the data will be used by legislators to make informed decisions.
Adding this rule will ensure that that is the case as well for the subject that we are discussing today.
DeWine making sure to mention these new guidelines support all patients seeking this type of care.
We need to ensure that adults as well as children are protected.
Governor DeWine also continues to say he will not address the other piece of House Bill 68, which would ban trans athletes from participating in girls' and women's sports. DeWine believes that should be addressed in a separate bill. Live at the State House, Carly Dion, 10 TV News.